We'll address specific muscles. Today we're going to focus on the hamstring. So as you guys know, the group of muscles of the hamstrings, the bicep femoris, short head, long head, semitendinosus, and semimembranosus, they all have the same origin. All right, they do cross behind that knee, the posterior knee, and makes its way semitendinosus, membranosus on the tibia, and then the short head and the long head of the bicep femoris on the fibula. So the whole treatment goal of when you're stripping these muscles is to try to get as high as you can towards the origin, all right, and definitely get down towards the insertion because you have more access to the insertion with the treatment. Right? Obviously, the most important thing is to get the draping as high as you can as possible without exposing the entire buttocks region. So usually you're going to look for that line right here, which is the cleft, the gluteal cleft, all right? And that's going to let you know you're right. You're pretty close to the ischial tuberosity when it comes to stopping or doing your friction and hitting that origin, all right? As you guys know, if we come off on the lateral portion of the leg, we're going to come down to this outside portion, all right? And try to get our best to this head of the fibula right out here, all right? Same thing when we talk about the tendinosis and the membranosus. We're going to try and make our way to that posterior region of the tibia, all right? So treating these muscles, it's more than just doing a simple effleurage and a petrissage. Once you're treating these muscles, you're getting in and you're stripping these fibers. Whether you use the two-hand technique, whether you get here and use your forearm, all right? So first and foremost, after you warm up this tissue and you're getting in to do your deep tissue work, all right? Your treatment at the ischial tuberosity is going to be one or two things, all right? You can use the sheets if you need to, if you're not comfortable with, or if you want to get a better grip, but it's going to be a friction movement. You can stabilize the hip and you can use this friction movement. So we're just applying friction right at that muscular tendon region of the ischial tuberosity. You can use 2 fingers. And what you're trying to do is just to break up that fibrotic tissue up there, all right, before you start to strip these tissues, the muscle fibers, all right? So I like to get in and break it up a little bit. I use a towel if I need a towel or the sheet for grip. If you don't need the grip and you're using more of a texture, a cream or oil that's more viscosity, then you could use that to get in. But my pressure going in is pretty deep. So I'm in that region, and in some cases you will feel the ischial tuberosity. You will actually feel this little hump, little rump, bony area of it. All right. Now, as I move on to starting to strip these fibers, all right, I may get down to the attachment sites again and do a circular friction technique. So we know we're right here for that back portion of the tibiosity, and then we know we're here for the head of the fibula. Again, some form of a friction to kind of break up that, to get that muscle to unlock a little bit. Now to strip this muscle group, obviously we know the muscles are a lot thicker than this drawing because it covers the whole posterior leg. You want to be able to apply that pressure, line of drive. I'm starting above this posterior kneecap, and I'm going straight up. All right, I'm going straight up to that line that I drew where the ischial tuberosity is. And as I get closer to that line, I'm easing up on my pressure. I may come back. I may now do two hands, 2/5, and I'm going up. See, my body mechanics is still. And as I get towards that line, you see I'm coming off that area. If you choose to come off laterally, now you see how I'm turning. You see my direction turns here, and I'm coming back. So the slower your tempo is, the deeper the pressure is going to be. So if I go at this 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, about 10. That's a pretty deep stroke. If I pick that up a little bit, 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6. It's a lot lighter. Still deep, but 1 1,000, 2 1,000, 3 1,000, 4. Then it's just 1 1,000, 2. So